So for treatment planning, I'd like to go over these the summary of these interventions with you. Just follow along with me as we go over them. One of the first interventions is called environmental control. We also call it stimulus control. And what this intervention involves is restructuring the environment in order to decrease the risk you have of hanging out with people or being in places or situations that increase your risk of drugs or other problem behaviors. And we're going to spend more time with people, places, and in situations that decrease your use of drugs and in problem behaviors. So how might this intervention be helpful for you?
Well, it'll help keep me out of trouble.
Yeah, definitely. It would help keep you out of trouble. Why do you think it would help keep you out of trouble?
Well, because, I won't be in the same places where I usually am. And, I don't know, not hanging around the same people.
Exactly, because those people and those places are often triggers, and they increase our, urges to use because we're used to using in those places. So if you decrease your, time spent in those places, then you're going to decrease the urges. So great. Chelsea, what do you think?
Yeah, anything that'll keep her out of trouble is good.
Perfect, great. All right, our next intervention is called self-control. This intervention involves redirecting your urges and your impulses to use and kind of controlling those urges and impulses to use drugs or engage in problem behavior. So how might this intervention be useful for you?
What do you mean?
What do I mean by what?
Well, like what you're asking me.
Okay, so let's go over it again. So self-control, we oftentimes have urges, especially if you are in those situations where you've used before, or maybe, you're just feeling really depressed about a bad grade you got in school and you just say, God, I really want to smoke pot today. And so those urges kind of increase your risk of using. Does that make sense? Do you ever have that urge or the temptation that you really want to use, or maybe you want to go hang out with some people and go to a party and kind of engage in those risky behaviors?
Yeah.
Does that make sense? So self-control is going to involve decreasing those urges. So once you get that urge, being able to stop your thought process and stop those impulses and kind of redirect them and engage in, more proactive and effective behavior. Does that make sense?
Yeah.
So how do you think that intervention might help you?
Well, like I said with the last one, I think it'll definitely keep me out of trouble and, probably, do something, instead of going to some party or...
Right. So it definitely increases problem-solving behavior. So instead of going to the party, you might have the urge to go to the party. You can think of alternatives instead. Because sometimes you can't avoid those situations where you might have that trigger or urge. And so being able to control yourself and kind of redirect yourself and find alternative behaviors is really going to be helpful for you. Chelsea, what do you think?
Yeah, whatever this intervention is, it sounds really cool. So that'll be something I'm excited to hear about,
Okay, and does the intervention make sense for you?
Yeah.
Okay, great. All right, the next one, I think this is going to be really great for you guys, is called reciprocity awareness. And this involves improving family relationships. And I know sometimes you've told me that there's some, problems with the family not always getting along. So this intervention is really going to be designed to help family members appreciate each other more and actually recognize what they appreciate about each other more. So it kind of improves those relationships because we get to hear all the great things about ourselves. We get to, exchange nice things and compliments and make others more willing and likely to do things for us. So how do you think this intervention might help you?
Well, it would help with the yelling and the fighting all the time.
All right. Good. Why do you think that this intervention might help decrease the yelling and fighting in your family?
It'll probably keep everyone more calm and more willing to talk about stuff, I guess.
Okay, because people, when they get along better, when they feel appreciated, they're definitely more likely to want to help you, to do things for you, such as make dinner or take you to the mall or let you borrow the car. People like to feel appreciated, and it tends to, increase positive feelings in the relationship. When we have positive feelings, you're right, it ends up decreasing yelling, those arguments, that kind of negative interaction. Chelsea, what do you think?
Yeah, I think it'll be good to have something where we're a little more cohesive as a family unit.
Absolutely. And I like that you use the word cohesive because this intervention definitely improves cohesiveness within family member relationships. And I bet you there are a lot of things that Chelsea does for you that you don't always recognize out loud. Maybe you do in your head, but you don't always tell her. And probably vice versa. There are a lot of things that, Joy does around the house that you really appreciate, but she doesn't know that you appreciate that. And it's going to make it a lot more likely that you guys are going to get along. So that's great. The next intervention kind of goes along the same lines. It's improving communication. We like to call this intervention positive request. And this intervention helps so that you can make more positive requests of each other. When you want a ride from Chelsea or you want a favor from her, you're able to do it in a way that makes her more likely to want to do it. You're more likely to settle disagreements this way instead of arguing back and forth, and it's more likely to increase your chances of getting what you want. So how do you think this intervention might be helpful for you, Joy?
Well, maybe she'll let me stay out longer, or she'll take me to the movies with my friends, or drop me off at places where I need to go.
Absolutely. And in exchange for all those favors that you want, you're going to be able to give her things that she wants too. Maybe in exchange for staying out later or a ride, just visit your friends, maybe you would do the dishes that night or something. And so, again, we have this kind of reciprocity. She gets, her back gets scratched, your back gets scratched, and everyone ends up happier. Chelsea, how do you think this positive request might help your family?
I like the idea of, getting more what you want, but in a nice way.
Absolutely. I think everybody wants to get what they want, but they want to do it in a positive way that, it makes it more likely, right? We don't want to be yelling, screaming, arguing, and I told you to do this, and that never works. So this will increase positive communication. Mm-hmm. Fantastic. The last one is going to be a great one for you. It's job skills getting training. So we like to call this intervention job club. And I know you're right at the age where you can start working. Have you had a job before?
No.
Great. Well, this is going to increase your skills, even of getting a job now or in the future, of getting not only a job, but one that you feel satisfied with, one that you're happy with, one that makes you feel like you're independent, you can make money, you can you don't have to borrow money from your parents all the time, and it's going to make you more satisfied. So how do you think this might help you?
Well, I definitely don't want to keep asking them for money. I want to make my own money, but I just don't know how to get a job.
And exactly, and at your age, it's difficult because you don't know those strategies, for interview skills or for being on the phone with a boss, and so we're going to teach you that. I think it's going to be really effective because you have a great personality. From what I understand, you have a lot of skills that actually would be, a manager would like, and so we're going to teach you how to use those and kind of funnel that into getting a job that's going to keep you out of trouble and get you money so that you don't have to keep borrowing from your parents. So, Chelsea, what do you think about that?
I think it's awesome. More constructive use of time. And then it'll teach her responsibility.
Exactly, responsibility, and studies have shown that people that have jobs and that spend more hours working are less likely to be involved with drug use and in problem behaviors because they have to be drug free to stay in that job. So that's great. So next we're going to go over these interventions and talk about your priority and how you want to set these up in your treatment plan.
Okay.